Thank you.
Wonderful. Are you going to be able to go to the ceremony?
No, I'm not.
Oh, I'm so sorry. This term. So we're going to try to do the best we can between her and me. Are there any suggestions or change of the minutes from last meeting, which would be February 27th? I have a few. First of all, on page 3, it's not the OEM. On the last page where it says clinical faculty member for Warren. Is that right? I mean, I know that that's how the 2.4 credits for 615 and 620 and 4.8. I don't know if it's credits, though.
Contact hours.
Contact hours.
Contract hours.
Contract.
Hours.
Oh, contract.
Contract hours.
And it increases.
Contact is clearing. I can't help you out, Joyce. I'm sorry, I don't have minutes listening.
Oh, I think we should check that because I thought that you said she was going to get paid the same every term.
No.
We'll not have to, we'll not have Bailey anymore. I think that's going very well.
That's good.
Is that?
Joyce,
Yes.
they haven't done anything in Venango, but that could be because of that, mix-up of the transfer of funds from the AEN grant. But still, I haven't got an account number yet. I was promised I would get an account number for Brenda's office, and I still have not gotten that account number from her. But I hear when I get that account number that you will transfer funds into that account so I can transfer funds into Art's account so that Art can, make some purchases of equipment for Venango. But I don't think there's been anything done at Venango, and that's probably the reason.
And then you open it up, and the needle should be sitting right there. And it is, you just reach down and grab it.
There's like a flat space on it if you peek.
Oh.
That's why I didn't want you to do it first.
Set that aside. I always put mine about right in that area.
Okay, hold still.
3/4 of the way back. Okay? Hold still.
I'm filming that. Just go ahead.
Okay. Of course, you've examined, cleansed your wound, and all that's in it. It's all ready to go. It's all numbed up, and he's set. So there's no, you don't have to start at one end or the other end or the middle. You just, when I'm examining the wound, I'm a lot of fingers because my fingers are in the wound, seeing how deep it is, seeing where the wound is, making sure there's no debris in it. And then I test the wound to see how best to close it. And this is pretty straightforward, so I could probably start at one end and go to the other. Sometimes in the real long, you might just tack in a few places and then start. And sometimes you have to remove those tacks in order to even up the wound. So I pick up one edge. We'll do it like this guy says. Take this down, straight down through with a little flip of the wrist. Notice how I'm holding it like this now rather than in here. Okay, you have better control. That's in your palm, like you were saying the second time. Then bring the business end of the needle up so you can see it. Then take it back down, pull this up. So you know where you are, about equidistant. And I'm kind of pushing through and pushing down at the same time if I'm using thumb forces. Okay, you come up through the little thing like that.
And let the needle do the work. You don't need to push it with your hand.
Right.
That's why it's curved.
And I drop the needle. I have this under control of my hand. Take a couple swipes around there. Okay, and then I kind of pull the knot to one side. Okay. It's a matter of getting used to working with different kinds of suture material. So I went this way, then I come back the other way for a square knot. Okay. right down on there. And for nylon, I use 5 knots. 4 is sufficient, but I always put in an extra.
When we
See
did
how
it
you do
earlier,
that?
we made
First
2.
you go
We
one
made
way.
one going this way, then one going this way. But he's saying he does that 5 times. Okay?
You have to do as much
5
as
knots.
silk, do you?
Hmm?
If you use silk, do you have to put as many knots in?
No, I use 1 less, 4. 3 holds.
The
I
deal
always
with
put-
silk, I don't know if you were able to appreciate that when you had your material presented to you, is that it has higher tissue reactivity. So it reacts more like a foreign body. Every suture you put in is actually a foreign body. So you always want to keep that in mind when you're deciding how many you need to close it, and why you need to get them out in a certain number of days. And
Came up. So press down a little bit. Kind of know where that. Always know where the point of your needle is, so you're not going through a vessel or something. Okay. Run twice. Put that right to the side. There's 2, 3, 4, 5.
also, like in the hair, you might put 6 or 8 just so you can find it easier. You're just adding more.
Suture is in too close and too irregular. So I get something like that. Okay, then
This is the what not to do.
what not to do. They tie like that. Okay. Now, I'm telling you, that gets in the way of wound healing. Okay, when you got the things are overlapped and it's too close to the wound edge, it just doesn't have a chance to heal, and it's not really everted very well. So that's probably one of the most common things that when you first start out. So go.
Yeah.
It's the first time you only come halfway through, so you can see the end. And you don't pull it out, you leave it down in there, and then open the other,
That's why you
right?
get the old people to start on because they've got so much patience.
Go to the unconscious, you know,
Yeah, that too.
because people are sleeping it off. Stick your hand in here and draw one.
Does this feel like human skin?
How about
So
that
that
one?
could be it. Okay, whose name is
So
it?
you leave your needle kind of
Janine?
right out there, and then tell it to the
Janine, you
side.
can choose something from the goodie box here.
Yeah,
You can first pick.
is that right?
Scooch
Do
in
another
there
one.
and see what you want.
I didn't know whether you pulled it through the whole. See what I'm saying? Do you just,
through the middle?
do you just leave it
I
there?
think that technically, I think what they showed on this video, we pulled up through the
Technically,
middle
you
of
go
the wound,
through.
and you go back through, yeah.
Yeah, I'll just tell my suture to know. Okay.
All right. Pick
So
blue out.
early 'cause
Okay.
it fell out.
Well, you know what? You got it once. You pick next. Who's next, Tammy? Ralston. Okay, Tammy, pick something out of the goodie bag here.
Hi, Phil. Thanks for brunch.
You didn't have to do this. Thanks so
You're the
much.
man. Happy
Did
birthday,
you do that?
Greg.
Filming?
Yeah,
Part? Yeah, we'll go home and edit it.
yeah.
I'll show you.
Where'd you get that image?
And Mitch goes in on all the food. He's teaching the ladybugs. Oh my, look at that.
Isn't that pretty?
Oh my gosh, is that beautiful? I will.
It'll go with your t-shirt. The t-shirt, is that blue or is that?
Oh, wow.
No, it's purple. Yeah, it's marlin.
Thank you so much for that.
Who gave you that, Gretch?
That's one of our Brazilian.
Glenn and Linda.
That's nice.
That's a Brazilian.
Oh my gosh, I love it.
All right, coming over.
Really pretty with the
Hi.
Oh my.
Hi.
Pretty with the
Hi, Mitch.
Close up.
color. Here, Mitch.
I'm coming around. Coming around.
Are you getting it?
Whoa. Very nice. I'll get a close up here.
Isn't it cute?
That's really nice. That's very nice.
Yeah, get to know the camera. You guys can take another mission trip.
It's good. I bet you're a handsome guy, but I have to tell you, your sister's a lot more attractive than you are.
We need to go less than a year before I see you guys again.
Cookie dough.
Is this from you?
Yeah, it's what candle.
Cookie dough?
Yeah, I'll wrap it.
Oh, it's a candle.
It's cookie dough candy.
Let's take it to Pete Pete.
Oh, it's a candle. I thought you meant it was real cookie dough.
That's a good one.
She's a sucker.
That's a strong one.
Yeah, it does.
That's a strong one. It's good.
Cookie dough.
Nice.
It's a heavy puzzle. I want to know what cookie dough smells like.
Getting it.
It smells like cookie dough, doesn't it?
You already had these?
It smells like an eraser I had in 3rd grade. What did I say? I like it.
When did you get these?
Tried to.
Before that day.
We can have to go or something like that.
No. You really did. Do you have a receipt?
Okay, what do you got?
Something she already has.
I had a Hallmark coupon for my birthday. You know how you get one for your birthday? So when we went to the mall for him to get his hair cut, I took it in and I bought 2 of these.
What are they?
One for Peek and Peek, one for our house. And there's the one I was debating on.
Oh,
You know
the
what, this is
suspense.
summer one. I could switch them around.
Yeah, you got a lot of time space too. I think.
This is the exact one that I bought for Peek and Peek. You picked out the exact same.
Oh, the
So
expense.
now I have 2 of these. This one was the one I bought for Peek and Peek. We don't really have a spot to cut up there. I have this one thing that's jammed under the, and I wanted to put something I could leave out. We have kind of
I
a
was gonna say,
leaf
put them both
theme.
up there.
Yeah,
Because they match.
Neat from Hallmark.
You could put one down by the hot tub, so when it boils over, we could cook meat down there.
I also thought we could put one down by the bar down.
Yeah, that's
You
funny.
know, I actually, you know,
Are they daisies?
Yeah.
sunflowers.
You can tell the kids, I like them so much, I got another
So
one.
the kids weren't with you when you picked them out, obviously, because they didn't let me in on it. And they wouldn't.
Pass that around.
That's sweet.
Close it up.
Oh, giddy up.
Get it out.
Mega. Oh my gosh.
Oh, yeah.
Then she told me, but I didn't know which one to get. There's like
I don't
a
have
whole
any.
rack. So
I know, I'm collecting.
I didn't know which
And
one.
this was the one that I wanted because I saw an excerpt of it on TV, and I thought we have to have this because I think Phil would love it. It's all patriotic tunes.
Yeah. There was 2 though that were kind of patriotic.
I know, but
and
I
didn't
think
know which
this
one.
is the one that's right after September 11th. I think.
Okay, give us a what is it, Gretch?
You know I have to go home and watch this. This
What is
so
it? What is
cool.
it, Gretchen?
Tell us.
This is God Bless America, Bill and Glory Gaither and their homecoming
Oh, the
friends.
Gaithers.
DVD.
You can watch that tonight.
Yeah. No, we gotta go to that concert
We're going
tonight.
to the concert tonight.
At 6. Okay, after.
There's a quartet.
Well,
of
the
You
musicians.
might want to stay and go, Corey.
After the Masters. Well,
They were.
CMA.
They're traveling the
It's
country.
the end of it too, isn't it? This is the last
Like
day.
the step.
And Tiger's on a roll, I heard.
They were awesome. They went
he
behind.
is.
Yeah, you weren't here.
He's in the hood.
They sang in church this morning,
It's
and they left,
off.
and everybody was just going, yelling, encore! Everybody wanted him to sing again. So Denny goes, yeah, I think they do need to sing another song. So he sent somebody back to the back and said, you need to get out here and sing another song. So they're like, okay. Seen anything of theirs? No. I'm telling you, you'll be hooked. It's so, isn't it good? They're on every Saturday night. They're on every Saturday night. You guys go. They bridged this band. We saw them. What happened was they were here in Pittsburgh at
They
Christmas.
transcend the generation.
They really did. And she goes, oh, see, they still travel with them. And I said, yeah, I'll tell you who else I really like is David Phelps. And she said, oh, yeah. You know, they all know each other.
Yeah,
They're
and he
like,
said,
sure.
boy, he
And I
sure has
said-
changed his image lately. What do you mean? Oh, both him and his wife.
She goes, they did the
lost a lot
LA
of
Weight Loss Center.
Yeah,
And they did,
LA
yeah, like
Weight Loss Center.
he did because we watched these old the old shows on Saturdays. And he's much heavier.
He was
So he's
pretty
definitely, his
hefty.
image has changed. Anyways, I was
Now
telling
he's
her how I walked up.
muscular and
I
very
said,
fit,
I was
yeah.
so completely, he was such an amazing singer. She said, he is. She said, he is by far the best singer they have ever had. That's why. She said, he is just so out of this world. And he just loves the Lord. And I told her how I was fascinated by him being by his spirit. And I walked up and got his hug and said, God bless you. And even she about fell on the floor laughing. Like, you. And anyway, there's another big singer with the Gaithers. His name is Jake Hess, and he's in his 70s. He's an old timer of the Gaither crowd. Judy.
And the old timers sit in the front. Like
In these big chairs.
In these big
These leaning
puffy
chairs that they bring onto the stage. It's like you gotta earn the right to be in the big wingback
What do
chair.
they
You
call
know?
them?
Hi, Corey.
She did call him something. there was a phrase she
There's a
used
phrase for the chair.
about the old timers of the Gaither crowd. And so when we were one of the old timers there,
Vigil
he's neat,
chairs
he's
or
a real neat singer. She is married to his youngest son, and I didn't even know he had a son that young. And so I made some kind of comment like that. She's older than I am, and she said my husband is 12 years older than I am. And I said, 12 schmells. My husband's 24. She looked at me like this, and she goes, she dropped her fork, she pulled her chair over. They were like, let's go. It was just so neat. I mean, she's like, kind of was hesitant to say that her husband was 12 years old. I said, 12 schmells. And so we just clicked. I mean, when I'm singing, she wasn't singing. And we all look at each other and go, oops, fix that. Because you can't tell. We do it all by ear. There's no music out there. There's no music. We do it. We listen to the tape and then try. Listen to the tape, to get it. Yeah.
Oh my God.
Is it Gruder?
I'm not worried about Corey's life. I'm worried about mine.
Thank you, sir. Hi, what's your name?
Andrew
What's your last name?
Schumacher.
What are you going to do today?
Flying an airplane.
How old are you?
5.
Have you ever gone flying before?
Yes.
What do you expect to see up in the sky?
Clouds and many, many things called cars.
Okay, called cars. Who are you going with? You better know your pilot's name. What's his name?
Mr. Thompson. Mr. Thompson.
Mr. Thompson is your pilot. Are you comfortable? Are you excited?
Uh-huh.
You're gonna see
Really?
so much stuff.
You want to show me around the plane?
What's the best way for Andrew to sleep? Up here?
Ask Mr. Thompson all your questions.
Or you could call him Mr. Glen. Make sure you stand on that little.
Okay, where's he going?
Close to the other side. Get in.
Well. You could have 4 people.
Hi.
I haven't been in this plane in the United States yet.
Andrew, Mr. Thompson is totally the boss today, okay? You listen to everything he says.
It is high enough.
Oh yeah, that's good. That's real good. Now, is there a place to put the seat belt through, around, over?
I think you should. You'll be able to see one too, or come get his picture over here, Mitch. I'm right here. Take a stilly photo of him. Look how cute he looks right there.
Ow.
Is it gonna hit him in the right place, though, Glen? Let's
Andrew, how you doing?
Andrew.
You doing okay in there so far?
Uh-huh.
You comfortable? Are you excited?
Is that Glen? I don't want it that tight. I don't think that's too close.
That's too
Mom,
tough.
those go right here.
No,
right
I
in here.
You got it.
What's that?
Am I the
co-pilot?
You are the co-pilot.
Hey, this is cool.
Or is it the other way? That's why I'm saying the joy. I'm enjoying that more than anything.
Hi, Phil.
Hi, Mitch.
How you doing?
Showing you like over there.
What do you do? Well, pretty soon you're gonna have to reach out here and fly this.
This is a limited, huh?
You do that.
Oh no!
yeah,
Hey,
that's
once you're
right.
up
We'll
in
let
here,
him
you have
do
to
it.
fly it, not me.
Hey, Drewster. Are you going to tell your friends that you went flying this weekend?
Hey, Linda, can I just get it? I'll just.
I can't see.
Hang on, you will
We're
be
gonna
able
take
to.
that down so that you
Bubba!
can
But
see.
hang on here. All my co-pilots
I'm
gotta
not
wear a
doing
hat.
that.
All my co-pilots have got to wear a hat.
I'm the code pilot.
You're the co-pilot. A hat. You know what else you're gonna get? You're gonna get one of these.
What are those supposed to be for? They call all their planes?
Yeah, we're gonna talk to the other airplanes.
I don't want to be the code pilot.
You don't want to be the co-pilot?
Why not? You want to just be a passenger?
You want to be a passenger?
I I just want to sit right here.
All right.
Okay, but you know what? To sit right there, you still have to wear this.
Why?
Because it's important.
Because
70s.
here you go.
Let's see, Andrew.
Okay.
Say breaker 19 for 1036.
Hello, hello.
You can't hear anything yet, I don't think. Okay, I got to do some checks. I got
Flat, and he's got a hanger there.
Oh, really?
Uh-huh.
I need to know this guy.
Yeah, he's right by 79.
I don't want the hat on.
That's closer
Well,
to
you-
our
you
house
need
than
the
it is
hat.
to 79. You know where his house is, hon?
No.
You know, you're going down 48, as you turn to the right, going out of Prospect, you go straight there by where the dogs are.
Big brother doing
miles
today?
is right there on the right side.
Oh, you have to turn
Going
right
on the
again.
plane?
It's going on a plane.
Because you go straight.
Do you want to go on the
back
plane
down
yourself?
the racetrack.
Why not?
Right, well, yeah.
Because I don't want to.
Right.
No. What do you want to do while you're on the ground?
You have to stay and protect Papa.
You want your head buzzed?
I want to go home.
You want to go home? Why?
Because my daddy said so.
Okay.
He
Look,
just
he's
did it with
testing the
wings,
plane.
Okay.
Did you see the wings?
Yeah.
Yeah. Can you be a plane?
Uh-huh.
Let's see you fly around.
Hey, co-pilot. Hey, co-pilot, over here.
That's pretty good. You're a good flyer.
So much more joy for me to watch him.
Yeah.
That's the gasoline. Check the patient. Okay.
Hey, Drew. Did you hear that?
What?
What was that sound?
Wait.
Yeah, it's pretty loud one, huh?
I like the hat. That's a good touch because I think that'll keep it from being too bright.
Be sure you save video, Mitch, for when he gets off, so that Andrew can go, oh my, because he's going to be extended when he gets off. You probably have 40-some minutes left of that. Not 2 hours, or either 1 to 1.5. And the other tapes are in the bag.
Hey, bud.
Hello.
Oh. Turbulence. Well,
Does it cost you to use the runway? Does it cost you to store the plane?
Yeah. But they take it out.
so Andrew, do you think that's the radio?
Yeah.
You think that's the steering wheel?
Yeah.
Why is there 2 steering wheels?
Because there has to be one for the co-pilot.
One for the co-pilot. How you doing, Gretch?
Okay. Okay, well, left-handed. Lefties always go backwards. Here, Gretch, can you see Gretch?
Down on this to tighten it, and if you need to get out, it's
Yep.
like
Excited? Yeah.
it's going to be noisy back there.
Yeah.
Okay, you all ready for that?
Unfortunately, I'm sorry that we don't have another set of earphones.
Bye, G. Have fun. There's water there on the seat, too.
I just like my
Yeah,
Okay.
this is great.
You're going to all need
Did
to
you
clear
check
back.
everything?
Yeah, you're going to need to all clear back over there.
Sure. We'll go stand right ahead and the wheels here.
What do you need me to hold?
Hi, Mom.
I bet you have to get the for the child.
See him way down there? Okay, he's going to turn around, and then he's going to fly right up over here. We'll watch him, okay? No, he's turning. See him turn?
He's going to ask if there's anybody else around, right?
Yep.
What do you do? You just say, is anybody that landed? Or?
Butler Unicom. Ready to take the active. There's nobody coming in. You can see no one's coming in. Visually.
Gretchen will love that for her birthday.
Yeah, she will. And she'll think it's so big on the video because you're zoomed in.
Because we're gonna.
There are rules about who has the right of way when.
What a great day.
It
You
is.
know somebody landing.
You tell this
like
camera
coming-
Propellers.
There's engines. There's no propellers.
The
isn't there?
propellers are off.
They have to notify.
Unless it's a jet.
No. It's a twin.
I gotta figure out where about will he hit the air.
Bless them.
Absolutely. Gotta get centered on the runway.
There he is. He's turning. You going to watch him?
I have two pictures, so I
Here he
can
comes.
get two shots off
He's
quick.
flying.
Oh, it's on that.
Wave at him.
There he goes.
Now, I can't get the excited shot on the come in. That was it. That was it. Yeah, that's okay because I can take it in tomorrow. Oh, look, that's really cool. You'll have immediate gratification. I like that. For Andrew's scrapbook. Keeps that woman warm.
Wear a pillowcase.
Yes, sure. She's required to be down there for that whole week.
Is that Glen, Gretchen, and Andrew? That's the question. I think it is. Coming in for a landing.
Is that him that came in?
No, but do you think that's him over there?
It very well
Could
could be.
be.
That's what I said before. I said it's a win over like assessment, but I can't tell much more than that.
Ding dong means it started recording, and ding dong then again when it stops. Actually, it's just a beep like that when it starts.
There's
Whoa.
somebody else crossing over. Maybe that's him. Are you guys gonna take Gretchen?
They have a car.
Well, that's right. She
Highland
has a car.
next to each other.
She drove so. You still have to go back with her?
No, I think he wanted to watch golf.
Oh,
He's a big, big golfer.
is he really?
Not surprising. That's what
You know, I don't understand. I don't know whether he has one light or whether that means that one light is
Coming in.
Is that him?
I can't tell. It's awful. They're all at the same. It's like seeing your kids in a graduation uniform or something. Everybody looks the same. I still can't read the numbers.
It's him.
I don't think that's him. Is it? He has red stripes.
No, it's on it. It's 707 Papa
Really?
5200.
Let's pop a tank.
Okay, here comes another guy.
TT. he always tells me it flies just as well 1 foot off the ground as it does at 20,000 feet. So you're bringing it nice. That looks more like it.
Yeah, that's. Did you read those letters? I like to laugh. I like to tease ya.
Hey.
Did you have so much fun? Here. Here, I can put your foot on there only. Okay. There you
Why
go.
only there?
Because you'll break the rest of it if you see it on the wrong part.
Okay, Andrew, come over here.
Uncle Mitch has
So,
to interview you.
how'd it go?
Whoops, it's so connected.
Was it fun? Well, look at the camera for a second. What did you see up there?
Did you guys have so much fun?
My house?
You saw your house?
Uh-huh.
Did you point at it?
No.
Were you scared at all?
No.
Was it fast?
It looked like it wasn't, but it was.
It was fast. Was it just like you expected, or was it different?
It was different.
Why?
Because they had really tippy turns.
Oh, did that scare you? Did it get you in the stomach?
So special.
A little?
A little.
Yeah, but it was fun. Would Riley like it?
No way.
Did your mom like it?
Yeah.
Hi, G.
We saw the house.
Good.
Uh-huh. And Mommy saw 2 houses over by Grendale that she did.
Two houses?
By Grendale that are over there that I didn't know were there.
Imagine that.
Check those out. They're beautiful. Well, there was 2. Like one's a big log house. That's why I wanted to go look at it. We also found the runway. We
Good.
saw where Jan's is. Yeah, we'll talk with Jan because he'd love to use it.
Give a little.
Hi, pilot.
Hey, how you doing there?
Nice flight?
Well, it was a great flight. A little rough up there. I think we threw people around a little bit more than just a normal day.
What was top speed?
Oh, we were doing about 112, 114 airspeed. We had a good tailwind part of the way, and we were doing 140 knots coming back here.
All right. Anything extraordinary up there?
Well, we were over top of Lake Arthur, and we found their friend's runway. We know where that is now.
Yep.
It becomes an emergency strip until we become friends, and then it becomes a local landing strip.
Yeah.
Good.
It will be. Jan would love that.
Good. Well, we got good video.
Okay, good.
All right.
And it's recording. See the record button up there? And of course we can zoom in and we can zoom out and then I can just press record. Even the certification exam will not expect that. What will be an important factor is for you to know things like maybe how the medication somebody who has a history of rheumatoid arthritis, how they might affect them in acute complaint. You know, so for instance, it's the same scenario if somebody was on Remicade or methotrexate. As you know, that has some interactions with some other drugs. That's more the area that you'll need to focus. But you don't have to know, the in-depth length to how far we treat osteo and or rheumatoid and lupus, unless you're going to be working in a specialty office. Yeah. Oops, they're muted far.
Go ahead.
Yep. Go ahead.
I'm not sure how anyone else feels about this, but I'm kind of gray on where our boundaries are, you know what I mean? Are we going to get more of that in 750 or...
What do you mean by boundaries?
Meaning, like, yeah, like our scope of practice as far as what kind of things are we allowed to, you know what I mean? And I don't know if I'm the only one that feels that way.
No, you're not the only one. I still feel that way. When Dr. McDonald went to the Dominican Republic and said, there, the office is yours. I remember, no, I still feel that way, but the bottom line is the law really decides what it is, and we have a collaborative agreement. Your scope of practice will be defined. What's that?
I said, so we're still a little, I mean, we have some leeway. It's not necessarily cut and dry and black and white.
Well, and that's I think makes this advanced practice role so challenging is that we don't have a real cut and dry line between, physician to advanced practice nursing. It's really, really all over the place. And again, largely that will be, and you're going to have to say, I had a brief introduction to this. I'd be glad to do it, but I would prefer that you assist me in the first 3.
Okay.
That's where I found the most challenges. Where Mike would say, go ahead. And I said, wait. That was like in Glen 1, and that was a year ago. And, so I think too often you will have to be assertive in your boundary making.
Okay.
Sometimes you might go to your physician and say, I really feel comfortable doing this, and if you want, I'll even perform it for you a few times, and at that time he might, in his head, sign you off to be able to do it. But there is no, there are general laws, we have prescriptive guidelines, those are pretty clear cut,
Right.
Things like that are very clear cut. But generally, if you're anxious about your scope of practice, you're normal. That's a very, very normal feeling.
Thank you.
And hopefully, you always be upfront enough with the physician that you work with, or physicians, or group, to say, okay, I need an open door where I can come to you with all questions. And I'm going to be annoying for the first year, but after that, you'll function more and more independently. We used to joke because in the office that I work in, when I first went to work there, I was very anxious nurse practitioner because I was like you guys, I was like so afraid of screwing everything up. And then my husband's cousin, who's been an NP for 40 years or 30 years, her license number is 70. So you can see how many years she's been in Pennsylvania. She was working there also. And so when he'd have like these little meetings, that would be him kind of telling us about coding and everything, I used to joke and say he has ball and chain on one leg and the Lone Ranger on the other. Because she'd be out there just practicing like crazy to the point that he'd have to reel her in. And with me, he was always trying to shove me out there. So it's a relational aspect.
Okay.
Any
It
other?
seems like even in clinicals, some of them seem to want to let me just go ahead and do it, and I'm like, am I allowed to do this?
Okay? This lecture will not put you in a rheumatologist's office feeling just fine. Okay? But that's not what you're designed to do. So we're going to try to keep this from a primary care perspective. You can get really carried away with all the treatments and where everything's headed. But it's like diabetes. You probably are not going to do a lot of it. Okay? So just please keep that in mind as we try to take on these big disorders. Don't be overwhelmed by them, because you don't have to be, the big cheese on it. All right, I want to just begin with articular disorders because you're going to see those first. And you're going to see those a lot, and those in time, you will become someboditis. Not even the shoulder, ever?
You're muted.
You're muted.
Oh. Has anybody ever had bursitis?
Not officially diagnosed.
It is horrible. Okay, I had it once. My mom's got it right now. And typically, a lot of people you see it in the shoulder. But what you'll see often, is the camera on me? I don't know, can't tell if it's not.
Look at
I'm showing
Gretchen.
something.
No, it's on PowerPoint.
There you go.
Okay. What you'll see is, particularly in the shoulder, in this tenderness in here, can't lift. We'll go this far. Oh, I can't get dressed in the morning. I can't get dressed. That's the most typical bursitis you're going to see. It's very acute, sudden onset. Tendinitis is an overuse kind of thing. Bursitis comes from an injury. Mine was, I was learning to golf. Okay? And, you do all that swinging. I didn't think I was hurting or anything, but I actually woke up in the morning going, oh, I can't. I literally couldn't move. And here's the killer. The best drug for it is Indocin. What's the problem with Indocin?
A lot of people get headaches.
Headaches,
Another
stomach. I'm telling you, it'll rip your stomach in half. And so, meanwhile, it cured my bursitis in 12 hours. It was gone, but I was laying flat because my stomach was killing me. It was like the lesser of two evils. So, bursitis is most common cause is minor trauma, and it doesn't usually occur before 20. And the reason is because the joint gets aged that eventually the bursa gets inflamed. So you shouldn't see bursitis less than the age of 20. It's usually very abrupt, sudden pain that increases with movement. And like I said, when I was just let my arm hang, I was fine. I felt nothing. It's just with movement. It's pain with movement. sudden onset after repetitive movement, and swollen, red, and tender joint does not hurt at rest. How often does the shoulder get swollen, red, and tender? You can't see that very well. It's internal. So don't expect the swelling and the redness, well, tenderness, yes, but not swelling and redness with the shoulder. You won't see it. But bursitis of the knee, bursitis means they say, I have sudden shoulder pain, it hurts terribly, I can't lift my arm, and they've got a fever. That would clue me in to go, ooh. I would be getting some blood work, checking a CBC, and if you decide you come to the diagnosis of sepsis, septic bursitis, they need about a month of antibiotics. And often you send them to ortho to get that fluid aspirated. The aspiration gets repeated until all the fluid stops accumulating. Because you know if you have a septic joint, like avascular necrosis, you can pull all that fluid out and it'll just fill back up again. Most of you probably already know that. So if you're septic, if you have septic bursitis, ER would be a good place you'd see it because it'd be sudden and somebody have a fever and chills. And like my husband, he'll aspirate joints all the time like that. I don't. Usually it takes about 2 to 3 aspirations over a week or 2 to get all that fluid out. And you guys can read my notes. I figured you'd read those later. Olecranon bursitis. This is my favorite bursitis. I love this. This is so cool. Has anybody seen it before? It's awesome. I love it. And when somebody comes in, the physician I work with always says, send them to Gretchen. The NSAIDs, I have yet to see NSAIDs even treat answering. No one has them to ortho.
I have multiple sides arthritis. I have it in my hands and my back and my feet, you know. But I'm to the point where I'm almost ready to go back to the orthopod again after 7
Well, Anserine, when I've seen Anserine injected, they do very well. So you might try NSAIDs for a month. And you know, if you don't see results, don't keep playing around with different NSAIDs. If it's Anserine, they need to get it injected. And that usually does better. Okay? Now, occasionally, you've seen Baker's cysts before? Has anybody ever seen one? Oh, they're so bizarre. Yeah. I've never seen one in the office, but I used to see them in the ER when I was a staff nurse, when they would rupture. You're usually asymptomatic one right there. The treatment would be to aspirate and instill a steroid, but I've never even seen that done. There's other places to get those cysts, but they're not as common, and they're on your paper. This is very, very common, tenosynovitis. This was probably the first thing that I had seen that I ran to my books, and I was flipping through, and I realized I'd come up with the diagnosis, and I said, Dr. McDonald, I really think it's tenosynovitis. And he was like, oh, you think, do you? Okay, and it was. So tenosynovitis is another one. These are the feel-good diagnoses. You'll think you're cool because you made them. You get billed higher when you code something as precise as this versus knee pain. Your doctor's going to be very proud of you, and you're going to be very proud of you. So these are just fun diagnoses. Tendinitis and tenosynovitis generally occur simultaneously. The theory is, and my theory, I agree with it, is that you get a tendinitis that goes on and on and on and isn't treated that turns into more of a tenosynovitis. Okay? Usually it's from exercise and overuse. You know, the most common one I see is hammering. Somebody who hammers has a limp wrist, and they get it. Tenosynovitis in here. De Quervain's tenosynovitis. Yeah, that's probably the most common, but you can have it other places. Most common is dorsal extensor tendon of the wrist, and that's what I was just saying. So you will see it. But for the most part, many of these are men who say it's been bothering me for like a month on and off, and now all of a sudden I can't stand it. Okay? Now, with the tenosynovitis that you can see in this picture, can you see right here the swelling? Right there? Yeah. That is how my husband put it. It's horrible. And see what happens is at this insertion site right here. One of the ways that I describe tenosynovitis to my patients is they'll say, what is it? Why does it hurt? It feels like it's creaking in there. And I'll say to them, well, you have to remember, you have a tendon, and I'll use my finger. And I'll say, then you have a sheath that's over it, and the sheath is greasy. And it should slide, anytime you move your hand, this slides out. Or I would try to make pictures for them so they can notice how it should be a lubricated joint. So when you move your fingers, this should slide out. When you move your finger back up, this should slide in. And then I'll say to them, what happens is the sheath gets swollen, and you can't get things through it, and it hurts, and it creaks. And they'll go, oh, well, that makes sense. Many times people just want to know what is the problem inside there. And that's the site where it occurs most commonly in tenosynovitis. Now, you can have something called stenosing tenosynovitis, which nodules form on the tendon, and the tendon itself actually stenoses, okay? So it really won't slide. Have you ever heard of trigger finger? Okay, that's essentially, if you see a trigger finger and you call it trigger finger, you're not going to get much feeling. If you call it stenosing tenosynovitis,
Oh, higher payer.
that's right. So I'm teaching you some coding things right now. This is the case of de Quervain's veins tenosynovitis. That's the actual, your highest filling would be de Quervain's veins tenosynovitis for trigger finger, okay? And what you can see in the third picture over is the way you test it. You put the camera on me. And can you put it up? There you go. And can you zoom in real close to me? You're doing good. Okay. See how far it'll come into me. Okay. And you can see, maybe do it this way. You have somebody hold their thumb and put their hand down like this. All right, I'll go to shake hands, and I'll come in and I'll push the thumb down. They go, and that's how you can tell it's de Quervain's. Okay? They actually are holding the thumb and pushing it down forward. You know, just doing that myself, I just feel tension in there. So obviously even mine isn't that. Does that hurt at all when you do it? Yeah. And you can see that's an easy tendon to strain because it already doesn't have the greatest flexibility. I mean, mine's normal and it's kind of tender. Okay? What I do for this, because I try to tell people, this could get really bad. And injecting these is not fun. It hurts. Generally, if you give somebody a cock-up splint, you know the cock-up splints you get them in the ER? We have them in our office. I give them a cock-up and say, wear it all the time for the next, 2 to 4 weeks. Then I'll say, wear it only with working, and I'll try to work them into a real intense rest period. It will resolve if you can get somebody to do that. But if sometimes people say, I can't work, I can't type with it because there's too much on the splint that's around the rest of the hand, they do make these other splints that go just over the index finger. Okay, but I think they're a special order, and I don't know what they're called. You'll ever see. But these aren't bad either. But if you ever around Carrie again, maybe I should have had her shown to you at the seminar. She's got monsters, and she's threatening that when her sabbatical's done, she's going to go have one done one semester and one done the next. You're fired, sister. Okay. Ganglions are cystic swelling. You are going to see people come in with these going, what is this? They'll think they have cancer. They'll think, and this just requires a lot of reassurance. But you do see them. You do see people come in just for this. And they'll say, I can't stand this. And some will say, I just want it off. And occasionally you run into somebody with tenderness, but it's not that often. Okay? Generally, the wrist is most common, and they're asymptomatic. They usually less asymptomatic, and you don't treat them. And it's questionable whether insurance covers to have it taken off, because it is considered cosmetic. So you want to investigate that. All right, let's spend a little more time then on fibromyalgia, because that is a very, very common diagnosis now. Sometimes it's too common. There are people that have a diagnosis of fibromyalgia who really don't have fibromyalgia. And we need to be doing a far better job at looking at the criteria and understanding this problem so that those who truly have a fibromyalgic problem are taken seriously. Okay? You've all heard of it, fibromyalgia being a syndrome of widespread musculoskeletal pain. And in bold, I have the cardinal feature. The cardinal features are widespread, soft, and I repeat that, soft, not bony, soft tissue, aching, and stiffness. Essentially, it's every day, and it varies in severity, but they have it for at least 3 months. Usually, it occurs in young women, between 20 and 45. I have met a guy now and then that has a diagnosis of fibromyalgia, and I still question it. Because is that really objective?
No, it really hurts.
Yeah, but I mean, how can we call tenderness even, so if I was going to argue this, my argument would be there are no objective findings. I still think even tenderness is a subjective finding. So this takes a relational component with your patient. And diagnosis is purely clinical, there's no labs. So you have to make a diagnosis that's purely clinical, but at the same time, there really is essentially no objective evidence. So that's where it becomes sort of tricky. Well, then how do I know fibromyalgia? And I'm going to show you some of the ways that you do. Today we've learned a lot about it, and there is a lot, the criteria are very helpful. We don't know the cause still. The challenge is differentiating it from possible other disorders, 2 of which might be somatization and depression. But there are other disorders that can give you, tissue tenderness. I think there have been women who've been on estrogen for a long time that have had so much fluid retention and have complained and have stopped their OCP and it all went away, who had diagnosis of fibromyalgia. So again, it's differentiating it from possible other problems. It's a process of elimination kind of thing. Once you figured out it's none of these other things, start thinking the possibility of fibromyalgia. 90% are women, and it's also in your book, the next slide. But I think the slide that I have in here is a little bit better. The one in your book isn't that good. This is the trigger tender areas, okay? And as you see in your outline, there's 9 paired tender points, okay? First one is the occipital neck. And whenever you're assessing for someone who has fibromyalgia, you're trying to determine if they do, you never go down the line. This is what makes it hard. You might want to practice this. Do one occipital area and then move to the opposite thigh. Then later on go back up. You want to mix these up so you're getting a true reading about tenderness. You know, generally if you go on this side, say, oh yeah, on the other side, oh yeah, those two. You know, so you want to mix them up. The other thing is about this criteria is before we go to the 9 points, look at that there are 4 control points. And the 4 control points are the middle of the forehead, okay, right in the middle of the forehead, the mid-forearm, anywhere in the mid-forearm area, the thumbnail, fibromyalgists don't usually have pain in the thumbnail, okay, and muscles of the anterior thigh, okay. Those are the control points. So you want to also intermingle these tests of, you know, furthest distal, right? And the PIP is in the middle, right? That's right. So generally the furthest out, your DIPs and your PIPs are generally the ones that are affected. Knees, hips, spine, feet. But one way you can differentiate osteo from rheumatoid is this is what's usually...
I'm scared! I'm scared! Go get him, Lou. Go get him. Go get him. Are you gonna go in? I don't want to. Come on, you sucker. I need to go find
Morning dog. Okay, yeah, don't do anything to tease them, that's fine. Don't.
Very good, Miss Yaya. Okay, you want to show me?
There.
Ooh.
Nice shot. So what
Lewis, it's a nice beach today, and it's so warm out.
Get out of there, Lou.
It's like, go, Lewis.
Lewis, get out of there.
What's Lewis doing? What's Lewis doing?